Good morning, everyone. Bob Ravenscroft. It is August 18th, 2020 for our press briefing from Bryan Health, Vice President of Advancement, Chief Development Officer. Real quickly before the stats, no advanced questions, so if you think of them, send them on in. Otherwise, we'll have a short one today, but I want to give a couple of updates on our lab. There's been a lot of chatter out there about the saliva test that has been developed by Yale University. As all things, we're following all COVID testing related things that come to the market very closely. This is extraordinarily promising. What's important to know at this point for folks tuning in is testing is at this time limited to laboratories designated by Yale School of Public Health and Department of Epidemiology and Microbial Diseases. So at this time, other labs cannot use it, but it will be released to other labs not designated by Yale at this time at a future date. So very, very promising news, and we're watching it closely. A couple of other things on lab supplies. Our Cepheid test, again, that's the one with the extraordinarily fast turnaround that's used for stat orders in-house. Still in the critical phase from a supply perspective. We expect to receive more on Friday, and currently we have 7 days on hand. Our Aries test, which is the kind of second level down, which also has a 2 to 8, 9 hour turnaround. It's not in the critical stage, but we have that on caution. We currently have 18 days on hand. And then the routine test that we send out through LabCorp, we're in pretty good shape there. And I just want to compliment our lab folks that working with LabCorp and so forth, we're really fortunate here with what you hear throughout the country that our testing turnaround time is remaining really solid. It's between, the average is 1 day and 3 hours to 2 days and 12 hours right now. So a vast, vast improvement for those who have been following along. Then real quickly, this Thursday, we're going to have a special guest here to talk about the antigen test. I think people will find that very interesting and informative of things that are going on related to COVID. And then next Thursday, we will have a physician here speaking about convalescent plasma again and some calls to action that we'll need from the community in about a week or so. Real quickly, our midnight census was 444. We have now tested 19,479 patients. There are 2,228 positives at Bryan. And again, we're very fortunate. We only have 95 pending tests sent out to LabCorp. So good turnaround for the residents of southeastern Nebraska on getting their test here. In the hospital right now, we have 11 COVID-19 patients. 4 of them are from Lancaster County. There is an additional person that is pending their test result, also from Lancaster County, that's in-house. So 11 COVID patients in-house, 12 in-house that are positive or pending. 2 of those are on ventilators, and they are both from outside the county. And we still have 2 that are no longer positive but remain on ventilators, and 2 patients in our intensive care unit.